Welcome, everyone, and thank you for joining today's OnBoard Limited Release Phase 2 question and answer session for healthcare providers. Please keep your phone lines muted. We will be taking in your questions through the chat box. When sending your questions in the chat box, send them to all panelists. We're joined today by members of the project leadership team and subject matter experts from various board areas who will be answering your questions today. To begin, let's review the most common questions we have received from providers so far with DAPO from the board's Public Information Office.
All right, thanks, Mike. What indicates that a DME PAR is required? Some items on the DME fee schedule require prior authorization and are marked as PAR. The treating provider will need to request prior authorization for these items. Any item not on the DME fee schedule also requires prior authorization by the provider. A DME PAR should also be submitted if the item is not addressed, not recommended, or does not meet the criteria noted in the MTGs. If the item is MTG related, the PAR will require the MTG reference code, and the requesting provider should include rationale for why the item is being requested in the supporting medical. Can we search for items within the dashboard? Yes. The dashboard has a filter function where you can search for information contained within any column. As seen here, filtering lets you filter by the columns in your dashboard, after which you can select how the system should search your criteria. In this example, we will select to filter by patient and contains. Then in the text box, we will enter the last name, Gifford. Your dashboard will only show any PAR whose patient name contains Gifford. Can a delegate request DME prior authorization? Delegates cannot submit a DME PAR. They can draft all of the PAR information and save it for the provider to complete the submission. If a DME PAR is approved, but the insurer can obtain it at a lower cost than the DME fee schedule, can the insurer specify for more than one vendor? If it is approved for a lower price, the payer must provide contact information for 2 alternate sources. Can medical suppliers submit a durable medical equipment PAR? No. Medical suppliers can only submit a request for decision on unpaid medical bills, Form HP 1.0. Who can submit a DME PAR in OnBoard? DME PARs can be submitted by chiropractors, physicians, physician assistants, nurse practitioners, podiatrists, dentists, audiologists, and optometrists. Does the request for information trigger an email notification? Yes. You will receive an email notification for a new item in your PAR queue. An example of a subject line for that notification is NYS WCB OnBoard, New York item, provider response requested, Alan Richardson. What does an email notification subject line include? When there is a change to a PAR status in OnBoard, users who have selected to receive email notifications will receive an email, similar to the example here, which includes the notification of PAR status change, claimant name, PAR type, PAR ID number, and claim admin claim number. For example, New York State Workers' Compensation Board OnBoard, change in PAR status, John Smith, medication, PA-0046-985-123-456. When there is a new PAR assignment added to your queue, users who have selected to receive email notifications will receive an email, like the example here, which includes the notification of a new work item and the claimant's name. For example, NYS WCB OnBoard, New York item, Provider response requested, John Smith. How do I turn off or edit email notifications? To turn off email notification preferences, you can uncheck the PAR status updates email or new item in queue email in your profile. Will there be training for Phase 3? Yes. There will be a training webinars next week for providers, which will provide examples of submitting some of the PAR types introduced in Phase 3. The webinar information has been and will continue to be distributed via WCB notifications. If you have not subscribed, ensure you go to the board's website and sign up to receive WCB notifications so you don't miss future training opportunities. You can also go to the upcoming webinars page, linked at the bottom of the board's website, to receive the training webinar information. The OnBoard training web pages are also updated to contain the training web pages for Phase 3, similar to what we have done for Phase 1 and Phase 2. When searching for the DME item, can you search by description instead of HCPCS code? Yes. You can type in at least 3 characters of the description, and the selections that contain what you have entered will show for selection. For the remainder of today's webinar, we will answer questions submitted via chat, and I'll turn it back over to Mike.
Hi, this is Audrey Cunningham from the Medical Director's Office. There's a question with respect to the MMIS ID number. This license number is only a requirement for DME suppliers according to the fee schedule. That's correct. DME suppliers do need to be registered with Medicaid and provide an MMIS number.
Hi, this is Paula Rausch. There's a question asking to clarify if insurers can provide 2 vendors that supply the DME for lower price when the code has a fee schedule. They can. You can either approve it as is, which is on the fee schedule, but if you have a vendor that you know can provide the identical item at a lower price, you can approve it for that lower price and provide 2 alternate sources for them to obtain it. The DME fee schedule is in effect as of 4/4/2022.
We have a question asking about any system requirements to use OnBoard. And on the OnBoard webpage, there's a system requirements webpage that details what you need to use OnBoard. So OnBoard will run on Windows, Mac, and Linux operating systems via a supported web browser. And the supported web browsers include the latest versions of Google Chrome, Mozilla Firefox, Microsoft Edge using Chromium, or Safari. Internet Explorer 11 will not be supported for OnBoard use. OnBoard limited release is not supported on mobile devices at this time. And on that system requirements webpage that I mentioned, there are links that will assist you with upgrading the browser you're using.
There's a question about DME suppliers submitting prior auth requests, and the DME supplier is not a user of OnBoard or eligible to submit prior auth. It must come from the treating healthcare provider.
We have a question on whether the provider needs to submit the fees being requested for the DME item, or if it's automatically going to be the fee schedule. When requesting a DME PAR, if there is a price noted on the fee schedule, the system will automatically fill that in. If you're asking for DME that is either not on the fee schedule or has no price associated with it, you are required to submit an estimated cost when submitting the PAR.
There's a question asking if there will be a webinar done for Phase 3 of OnBoard Limited Release, and yes, the Phase 3 training webinar is next week on April 20th for providers at 12 o'clock p.m. On the bottom of the board's website, there's an upcoming webinars link, and if you go to that page, the webinar information is available there.
There's a question asking to confirm that auth requirements are derived from the DME fee schedule and not the MTGs. That is not accurate. If the DME item is related to a medical treatment guideline body part, the injured worker would need to meet the criteria in the guidelines for it to be appropriate, unless they're submitting a PAR. When submitting a PAR, the estimated cost is entered in terms of weeks. It's a weekly rental. There's a question, if New York MCG does not apply, can ODG be used? You can certainly use ODG as a reference, but the board does not use that as a reference. The medical treatment guidelines are the basis for decisions made for MTG-related body parts.
Hi, there's a question regarding clarification whether or not a medical provider dispensing DME out of his or her office must have an MMIS number, and medical providers dispensing out of their office do not need to provide an MMIS number. This is only for DME suppliers.
There's a question about requesting prior authorization where the carrier comes back with two lower prices and they might be using a third-party vendor that's not necessarily local to where the injured worker or the provider is. There is no geographic requirement for the location of the vendor that the carrier uses to supply the lower cost options.
Hi, we have a couple questions. One of them being, does a provider receive a notification after the delegate drafts a request? The answer to that is no. It will move over to their draft forms queue so they can submit that request. So you will have to let that provider know if you're drafting on their behalf, or they can check their dashboard daily if it's a higher volume provider. The other question about how to log on. To log on, you need a board-assigned user ID, so you will have to need to register with the board on the board's website. You can click on the medical portal icon, and depending on what type of user you are, medical supplier, healthcare provider, you'll select access and administration underneath that, and then you'll scroll down to the sign up button to register. If you're already registered, on the board website in the upper right, there's an online services drop down. You would select medical portal from that drop down and then select the login button.
There's a question about item L4361, stating it's a common ankle brace boot that this orthopedic provides to their patients, and it's not listed on the DME listing. They're questioning if it would fall under the exception for injury, exacerbation, or complication following surgery. It's going to depend on the individual clinical picture of that patient. If it is part of surgery, then yes. If they come in and it happens to be an emergency, that would supersede and you wouldn't need prior authorization. It's just going to depend on the circumstances in which you're providing the item. As a follow-up, if the MTG shows that a splint is recommended and the DME fee schedule shows that authorization is required, does the MTG supersede this? The fee schedule and the MTGs are used hand in hand, so they would need to meet the criteria in the guidelines. And if there's no price, you would still have to do the authorization.
Hi, there's a few questions as to whether or not code 99070 should still be used for DME. And with the new DME fee schedule, the codes for the specific items in the fee schedule should be used rather than the 99070.
There's a question about the HCS number and whether that is required during the registration process for the medical portal. For providers, that's a yes or no question. If you don't have it, aren't aware of it, the provider can answer no to that. That's just used as a convenience for providers. Will mirror the provider's HCS user ID, so they do not have a second user ID to remember. But if you answer no, yes, the board will process that and just assign a generic user ID.
There's a question asking what to do if there's no code for the DME item. There are multiple unlisted codes available in the fee schedule. You could choose one of those and put a description of the item that you're specifically looking for.
Hi, there's a question regarding the effectiveness of becoming a New York State Medicaid enrolled supplier, and it is within 6 months of the effective date of the fee schedule, which would be 6 months from April 4th.
couple questions asking if this webinar will be available after it's completed. And yes, you'll receive a follow-up email, and this webinar will be available on our YouTube channel to watch again.
There's a follow-up question about the HCS ID, and if it's not needed, is there any other number necessary? During the registration process for a New York State licensed provider, they do have to provide their New York State license as well as their MPI number. If they're already board authorized, they're also required to provide their board authorization number that's assigned to them. If it's an out-of-state provider, it would not require and even ask for the HCS ID, and it would only require their MPI number for that out-of-state, non-New York State licensed provider. There's a question about who can be the administrator for a provider. Only the provider is the medical portal administrator. In that case, only the provider would have access to add delegates and administer those users. If you're a medical supplier organization, anyone within your organization could be the online user administrator, and we actually encourage that you have more than one administrator in case the other one is unavailable.
Hi, we just got a question about no-fault insurance, and just a reminder, this is just workers' comp claims and related items. We're only covering that topic today.
There's a question if repairs require prior authorization, for example, prosthetic limbs. There are multiple codes within the fee schedule that do cover repair of prosthetic devices. Some of them do require prior authorization and some of them do not. There's a question regarding whether or not DME requests would go on a C4 auth or whether it depends on the body part. All DME requests through the system are going to be a DME PAR. So when you go in to originally request the PAR, you're going to have a choice of what you want to pick. You're going to choose DME.
There's a question about a medical supplier organization, in this case a hospital, and what MPI they use. The answer is yes, you'll use the facility MPI. Just keep in mind, when you're registering as a supplier, as a hospital, it's just to submit HP1s on behalf of that hospital. If you're submitting HP1s or PARs on behalf of the actual provider within that organization, you will need to be a delegate of that provider.
So we've gotten to the latest questions that were submitted, and we're just going to give it a couple more minutes for any remaining questions to be added before we close the webinar. So go ahead and enter any questions that you have in the chat box, and we will take a look. Thank you.
So we have a question asking if carriers are allowed to override the necessity for a PAR in an emergency situation. Emergency situations supersede the need for a PAR. So you wouldn't have to submit a PAR in an emergency.
And then we have a question about determining price. So to review, if it's an item on the fee schedule that has a price on the fee schedule, OBLR will fill in the price for you. If the item does not have a price, then the provider is responsible for estimating the price so the carrier has something to respond to.
There's a question about how long a provider has to escalate to a level 3. For all PARs, very similar to the medication PARs, it is 10 days. Within those 10 days after that, the provider would need to resubmit a request if they missed the level 3 escalation. There's a question if we have multiple providers in the same office, does each provider need their own login? Yes, they do. If they've been submitting medication PARs or if they've submitted a board authorization to treat workers' comp patients in the last 3 years, they should already have a medical portal login, as we've established that in 2019. So they'll use that same login. They do not need to re-register or get a new login.
There's a question about the OWCP medical portal and if that's related. I believe that is referring to the Office of Workers' Compensation Programs medical portal that's maintained by the Federal Department of Labor, which has nothing to do with what we're discussing here today.
All right, that will conclude the questions we've received, and we will end today's webinar. Thank you all for participating. We hope today's webinar helped answer your questions regarding Phase 2 of OnBoard Limited Release. If you have any questions following the webinar, you can email onboard@wcb.ny.gov, or you can call 877-632-4996 for other questions. If you have not already, subscribe to receive WCB notifications, where we will send all information about OnBoard. Lastly, the new OnBoard webpage contains detailed training information and new resources for providers, including the recently posted Phase 3 instructions. We encourage you to visit the website to review everything you need to know. At the closing of this webinar, you will be linked to a survey. Your input here is greatly appreciated and will be used to help us plan and improve future sessions and update our OnBoard resources. Thank you all again and have a wonderful day.